Hi, this is Dr. Mercado here at Orange State Dental, your local dentist in Downey. I get a lot of questions about periodontal disease, or what it is, how do we take care of it. I want to spend some time covering some of the most common questions I get about periodontal disease slash, gum disease. And the goal here is to help your understanding on the causes, the symptoms, and some of the treatment that we do and use for periodontal disease. So periodontal disease is fancy words for a gum infection around your teeth and your bone. So when you have periodontal disease, you actually have a bacterial infection. You have bacteria infecting your gums and the jawbone that support your teeth. So there's one cause for periodontal disease for the most part, and that's bacteria. That's the main cause, right? Specific bacteria get into your gums and into your jawbone, and that's what actually ends up becoming the periodontal or / gum disease, right? There's some related conditions, some related factors like genetics, for example, your current or previous health history that do contribute to that, but the main cause of periodontal disease is bacteria. So some of the symptoms of periodontal disease, actually most of the symptoms of periodontal disease are not really painful, right? So the most common that we see and most patients observe in their mouth is bleeding gums. So the patient flosses and there's a little bit of blood, you brush and there's a little bit of blood, or even when you're chewing some food, you notice some blood, some taste of blood, right? That's one of the most common symptoms that patients see. Another one patients do notice is, and it's unfortunately it's through other people, is bad breath. That's really one of the symptoms of very especially nasty periodontal disease. And for the most part, that person doesn't really smell it. It's other people around them that smells it, right? Another common thing you see with symptoms-wise of periodontal disease is actually bone loss. So you can only really see this with a dentist. They take an X-ray, we take an X-ray, and you can actually see some of the bone having been melted away around your teeth. That's one of the symptoms of periodontal disease, right? Another common thing I get from patients as far as questions is, doctor, why doesn't it hurt? And actually, periodontal disease can hurt when you're chewing, when you're brushing, when you have periodontal disease. It can hurt. For the most part, in my experience, I don't see very many patients with pain with periodontal disease. So we have a lot of history now, study-wise, in terms of the connected diseases to periodontal disease, right? They're pretty severe in terms of, and it's kind of scary because some of those diseases are related to heart disease, respiratory disease, diabetes. So things like that, even to this point now, we have a few studies now showing the connection between Alzheimer's and periodontal disease. So as far as your overall body health history-wise, it's very important to have your gums taken care of in terms of periodontal disease, because if that happens, other things start going wrong. So kind of bad news here, bummer. Periodontal disease / gum disease cannot be cured. One of the things that we don't have yet is at least a specific treatment, a pill, a therapy that just gets rid of periodontal disease, right? But good news, let's stick with the good news. We do have treatment, right? So those treatments are available, and they can't keep your periodontal disease from getting worse. They can help. So there's a few treatment options for fighting periodontal disease, right? So they pretty much break up into two categories, and it has to do with how severe your periodontal disease is. So if your gum disease is very advanced, you're gonna need some surgeries, unfortunately, right? And those treatments tend to help some of the disease or some of the damage that was done by the periodontal disease, right? For the most part, the majority of the population that does have gum disease ends up having to do sort of non-surgical. So you have cleanings, you have antibiotic therapy that right to your gums, right? Not a pill, but antibiotic therapy. There's laser therapy. So those sort of groups of things that we do to keep the disease or treat the disease so you're from getting worse. And for the most part, they're non-surgical or surgical options for periodontal disease. So one of the major things that we do, or major treatment options we do for periodontal disease is cleanings. It can be a deep cleaning, that type of situation. Then later on, you have a kind of sort of a maintenance cleaning, right? For a regular clean after you take care of the initial disease, right? But the idea here is that, one thing about periodontal disease and treatment-wise, we talk about pain. So for the most part, taking care of periodontal disease treatment-wise for the cleaning doesn't have to be painful. It should be done very, very effectively with local anesthetics, right? Topical anesthetics. It doesn't have to be painful. Now, when you do drop into some of the surgical options when you have very advanced periodontal disease, there is surgery involved, minor surgery. But even then, it should be taken care of, as far as pain-wise, taken care of with local anesthetics. And then after the surgery, you're given medication to help some of the symptoms. So for the most part, periodontal disease treatment doesn't have to be painful. So if you may be thinking you have questions, or you may be thinking you have periodontal disease, definitely give us a call. We're here at 562-659-7246. So hopefully I answered all of the questions you had on periodontal disease. If you need to take action and you may be thinking you have periodontal disease or you have some questions on it, don't hesitate, give us a call. It's 562-659-7246. Again, it's Dr. Mercado. We're here to help.